Dr. Rubenstein, let's talk a little bit about teeth bleaching or teeth whitening, as it is called. And I want you to talk to me about, as far as I understand, correct me if I'm wrong, there are kind of three major ways of doing that. One would be over the counter and get the strips and the trays and put them in, buying it at pharmacy, Ralph's, wherever. And then the other one would be going to a dentist and getting customized type of treatment. And the third one would be this thing, whatever they call it, Zoom, LASIK with some, special light. And it's all done in a New York minute. Well, maybe not that fast, but in an hour or so. Shed some light on all of them, a little bit the pros and the cons, if you don't mind. And if there's one I missed, if there's something else I don't know about, let me know about that too.
Well, if you find out about that one, let me know too. But essentially, you've hit the three. The over-the-counter bleaches are, let's put it this way, the bleaches are of two various types depending on the chemical compositions, and they all work basically the same, that they're producing hydrogen peroxide, which is the bleaching element, whether you're bleaching your hair or, bleaching your clothes. Well, chloride bleach is different, but essentially you're oxidizing out the stain. And you may see carbamide peroxide. It's just a chemical combination to get the peroxide in. Over-the-counter bleaches, I presume that the FDA only allows a certain amount of concentration because it's uncontrolled to be put in the bleaching strips. The answer is it will work. It may take longer. It may be more of a pain in the neck to put these strips on. But the answer is that is certainly a way that you could lighten your teeth. The other way is to have custom trays made and to have bleaches of various concentrations that you can buy from the dentist that you're going to apply in the bleach. It used to be that you would wear these overnight. Now the bleaches are potent enough that you could wear them anywhere from, I would say, minimum about 15 minutes to an hour, and refill the tray if need, if you need to move it faster. The other way is to come into the office and have what we call power bleaching, which is another peroxide bleach, but really supremely concentrated, that is heated up or sometimes chemically set off by the light or the laser, whatever you're using. And this is a sort of a quick way to sort of power up the bleaching effect in a faster time. Some people have sensitivity to cold. Most of the bleaches are built in with nitrates and fluoride today, and we have post treatment and pre-treatment stuff that you can put on to sort of take away the sensitivity. Some people are just sensitive a lot, and you have to watch that. And some people can have sensitivity for a while. It usually will turn around. The concentration of the type of bleach that you're using is something that's got to be controlled. If you're using very powerful things that need either a special light or a laser that dentist office can handle, we do make custom trays and give out the particular bleaches for people who want to bleach at home. We do usually a combination of both power bleaching with the home bleaching together, because usually you don't want to keep paying and paying for this. You're willing to replace the bleach if you have the trays. If you sort of go backwards, I guess, or you're getting a little bit darker, you can perk it up with the home bleaches. They will probably last for about a year and a half if you refrigerate them, and so
that's a good
you
point.
can pick
Let me
and
ask you.
choose.
So it brings me to a question. So basically, whether a person gets a power bleaching, which is the 1 hour kind of Zoom, obviously for the guys who want instant result, and I'm sure there are plenty of them around. Great, because the occasion might need it. I mean, your daughter comes home on Thursday and says, by the way, Dad, I get married next Saturday. and you might go,
45,000 veneers for her, but
Yeah. But you might need some fast power bleaching here. But once you have that power bleaching, you can obviously, because most of us don't change our habits. So if a person drinks coffee, red wine, sodas, what else? Whatever
Tea.
tea,
Right.
and smokes maybe. If he does those things, he will get yellow teeth again. But once he has done the power bleaching, or for that much, I assume, they concentrated very perfect trays. He puts it in, takes him a week or two, and then he's totally is where he wants. But then 2, 3, 6 months later, he may get a little shady again. So then he takes and goes and puts the tray in it for a day or two, whether he had a power bleaching or whether he had a customized tray at the beginning, and now he keeps his teeth white on a regular basis without ever getting them very dark again. That's what you're saying.
Yes, I mean the reason that we like, we usually try to combine it because
Right.
every the power bleaching with the home bleaching because I don't think anybody wants to go through the power bleaching more than once anyway. It's you have to have a lot of stuff put on to protect your gums and the necks of your teeth from the bleach itself. Two is that your mouth is sort of held open while the bleaching is happening in this New York 1 hour minute. And it's a pain in the neck. So if you achieve a good deal of the whitening and want to see if you can go whiter, you can certainly finish it off with the home bleaching. And as you say, if you relapse some, you can take out the home bleach, put it in the custom trays, and just seat it there for a certain amount of time, and you should return to back to where you were heading. And it's a heck of a lot more convenient than coming back and paying another fortune or less than a fortune, but
Right.
coming in and sitting there to do this again.
Great.
And it's
Now,
just as easy to make while you're there, we can probably take the impressions, get models, and make the trays while you're sitting in the chair having the other stuff done. So
right.
it's well worth it.
Right. Let me ask you a question about going to the over the counter. And as you said, with no doubt some workability. Sometimes you might need many of them. That one works for you, and you always have to take them longer because they're not so concentrated. So but if you're willing to do every day for much longer, put them in at night or whenever you watch TV, fine. Now, is it true, however, that a person should maybe go to the dentist before he starts that because he might have some fillings or some false teeth in it, which he just doesn't remember anymore because, who knows that 14 years ago we've got a filling in our front tooth. And now that filling, when you bleach, the tooth becomes white, but the filling stays the old color. So all of a sudden, instead of all yellow teeth, you have beautiful white teeth, and then you have a yellow spot here and a yellow spot there, like a zebra kind of thing. And that apparently doesn't look so good either. What's your take on that?
Well, yeah, I mean, you've basically described it. I mean, when people ask about bleaching, we tell them there are a few things that have to be done. One is that the teeth have to be cleaned prior to them having the bleaching done, because if you have tartar all over your teeth, if you have plaque all over your teeth, stains are, something that we have to get off that are physical, as opposed maybe tobacco stains, stuff like that, heavy coffee stains, not sunken stains from years of drinking. The answer is that you have to have sort of dentally clean teeth prior to the bleaching experience. So if you're doing it over the counter, obviously, what do you know? I always tell you that crowns and fillings don't bleach. They're not, they're inanimate objects. So if you have a crown that, sometimes you can bleach up to the crown, but if you have a crown that's dark and was matched to your teeth color that was there,
Yeah.
it's possible that you might need to redo that crown. We usually, if people are changing front fillings, and they want to get them obviously lighter because they're not happy that they've stained or worn over time, and they're going to do the bleaching. We usually do the bleaching first because we want to know where the color is going to, or the shade of their teeth, and then we go in and do the fillings. I mean, you don't want to do it, I guess ass backwards is the wrong way to say it, but
Well, it is like that.
you want to know
It
what.
just It is like that. It's just sometimes a filling was put in many, many years before when that person still had white teeth. He was 24 years old. He got himself a filling. His teeth were not yet all yellowed up. Now he's 40 and it's all yellowed up and it goes and bleaches and all of a sudden that thing shows up. Well, all right. Thank you very much. And let me ask you this. Do patients have a wonderful experience like when they see their teeth bleached, whitened, whatever you call it? Do they go, wow, I am good looking again? Is it like, does it have a great, is it worth its money? Is it a good thing to do to enhance your good looks? Yes, no, yes, yes, no.
The answer is yes. I think what happens is that I can never tell how light somebody's going to get. And
Sure.
sometimes after we've bleached them, I mean, the person who's going, wow, is me, because it's just, like sometimes you'll find the person with the darkest teeth, and you'll think, oh, nothing's going to happen. And they turn out to be the lightest people you've ever seen. And your eyes, I'm sort of like wowed by it. I mean, they may be wowed, but I'm sort of like sitting back going, wow, and
But
I
the
wonder
patient
whose
is
wow
wrong.
is more important, mine or theirs.
Right.
But
Well, theirs,
so
of course. Theirs, of course. Yours is professionally wowed. That's fine. But
right.
their one is because they want to go out and look good, have a good presence in their job and everything. I mean, we not for nothing they call a beautiful smile and then giving it $1 million smile. And people quite often, not the only reason, but quite often don't smile because they somehow feel their mouth isn't worth it showing. And so now friendly people not smiling. So if you have a genuinely friendly and appreciative person with a decent mouth, he will smile a lot. And yes, I do believe that over a year's time, over a lifetime's time, that could be easily worth $1 million in getting a better job. Never mind getting maybe the girl you want or the boy you want, being more appreciated. It's just, I do believe, because I've noticed it things myself, not with the bleaching, but I had a couple teeth, they started getting brown because I think I hit them in karate or whatever. And the point is, finally I took care of them. And you know what? I saw myself when shaving being there much more, and it did work. It is true that you smile better and more beautiful, and people appreciate it. So bleaching contributes to that, right?
Yes, I think that in this day and age, aesthetic viewing of both your appearance to yourself and to other people is just very important. Whether it's to get a job, to get a girlfriend or boyfriend, it's you don't want to be hiding your smile, and
By the
whatever
way,
ways,
yeah,
whether it's bleaching or veneering, whatever it takes, if you're going to do it, you should do something.
right. Well, it's not only about getting that new girlfriend, it's also about making your wife of, 25, 30 some years, and in many times more. It's totally okay to show her a nice smile too. It comes back beautifully. Thank you very much.